Okay, I think we're ready to have our 10 a.m. Agenda item, COVID-19 report by King County Public Health. And I think Glynis is going to introduce.
Yes, thank you, President Tollefson. Good morning, everyone. Good morning, everyone. At a previous board meeting, there was a request to invite a subject matter expert to discuss the current state of COVID-19 and answer some questions that the board may have. And I'm very pleased to introduce Becky Wright, as she is the program manager for King County's COVID-19 and health equity training and capacity building program. Becky has been working with Public Health, Seattle and King County since 2001 and provides presentations and trainings on information, resources, and guidance on COVID-19 with the goal of ensuring that our communities have the knowledge and skills to stay safe and healthy. When she's not working on COVID-19, Becky is the lead training and educator in sexual health education, has co-authored state education curriculum, and is a master trainer with the Office of Superintendent of Public Instruction. I'm very pleased to pass it over to Becky. Thank you.
Hi, everyone. How are you? So that was a great introduction. Thank you. You actually pronounced my name correctly. That never happens. So if folks who, sorry, I'm trying to pull up my PowerPoint. If folks whose cameras are not on would like to turn their cameras on, I would absolutely welcome it. It lets me, one, get to see your faces, and two, know when people look confused or like, So I, like Glenna said, I'm Becky Wright, and I've been with the county since 2001. Clearly have not been working on COVID since 2001, but have been working on COVID since the beginning of the pandemic and now on monkeypox as well. So yes, I've been with the COVID-19 mitigation task force since March of 2020. And the reason I say that is that I think not only are there questions today about the vaccines and boosters, but a lot of the, so much has changed. It was a brand new virus that we had to learn a lot about, and we have changed. So we, the state, the CDC, the president have changed so much in terms of messaging that it often leads to distrust of the messaging and of the information that I share and that other folks share as well. So I just want folks to know that I've been here since the beginning of the pandemic, and I'm happy to answer questions that I have a list of questions that I received. And so I created a PowerPoint around that list of questions, but I'm happy to answer questions from, why did this happen a year ago? Or why aren't we still doing, why did this change? Or how did we go from here to there? Because I do think that it can be confusing when you're not on the inside and getting information around why all the changes. And I also think it helps build the trustworthiness of the messaging. So thank you for folks who turned your camera on. Governor Francis, it's nice to see your face. It's just lovely to see people's faces. My work prior to COVID was all in community, all day, every day. So I miss seeing people's faces and looking at my own all day. So with that, I did create a PowerPoint. It's pretty. I don't really care about my PowerPoint. So it's up to you all too, if you would like to, I'm gonna share it. If you all would rather me just go through the questions, I'm happy to do that. Like I said, I have a list, but I really did build them all into this PowerPoint as well. You're also welcome to interrupt me. You're welcome to put questions in the chat. Glynis, would you mind managing the chat in case I miss things? And then if you don't want to, I know we always say there's no dumb question, but there really, around COVID, there really isn't. Things have changed so much. It's constantly changing. I literally do a bi-weekly community partners call, you are all invited to it. I meant to actually put a slide in here about it, and I can send it out to Glennis to get out to everybody if I haven't already. But I literally hung up from a call, actually multiple calls, and what I had just said in the call had completely changed by the time I hung up the call. So, you know, it happens. And so you're welcome to ask me questions out loud and unmute. You're welcome to chat me questions. And then if you want them to be private, you're also welcome to to chat them directly to Glennis, and then she can ask them for you without naming who you are. That way they get to be anonymous. All right, so, and I love dialogue and conversation, so please feel free to engage with me as well. So are folks, do you want to see the PowerPoint that I built around your questions, or would you like me to just go through your questions?
I would suggest, Becky, that we go through the PowerPoint.
Great, awesome. Is everybody gonna let one person speak for you? Or do other folks agree with that? I always say the one person who speaks gets to make the decision. All right, I see some thumbs up. All right. And if I don't hit all your questions, please let me know. There was one I was a little confused about, so if I don't hit it in the presentation, again, you can instant message me or Glennis. I may miss it because I'm managing a few things. So again, we're going to focus on the COVID-19 questions you asked, but again, if you have questions, I also work on monkeypox, also sexual health educator. So whatever you want to ask, go for it. All right. So one of the biggest questions was, you know, why, what do these things really work? Everybody, you know, and I get this question constantly because everybody knows everybody who's gotten COVID. I am double boosted and got COVID. We go nowhere, do nothing because I know too much. And my partner was the only one wearing a mask at the pharmacy, and it was a 20-minute line, and everybody was sick. And one person walked out with the home test, and bam, we had COVID. So do the vaccines and boosters work? Yeah, they really do. And what do I mean by they work? So first of all, we now have Moderna, Pfizer, and Novavax. We don't recommend Johnson & Johnson anymore, and I'll explain that in a minute. They're safe, they are effective. I'm going to skip this for 1 second and say, what does it mean when we say that they work, that they're effective? It doesn't mean that people aren't going to get COVID. People are going to get COVID. In the beginning of this pandemic, during the alpha virus, we had the most effective vaccines we've ever had. If we had globally offered the vaccine to every country, regardless of money, and vaccinated most of the world at that point, we would not be where we are today. That's the fact. It is a global public health issue, and often, unfortunately, we do not take care of countries that don't have finances to pay for the vaccines. So when we say the vaccines are effective, yes, people are going to get COVID. They were less likely to get COVID during the alpha strain. And now that we've had these new variants, they're much more contagious, meaning they have much more virus in the body. So the big thing with Omicron, why we had such a huge outbreak with it, was people had much more virus in the body. So it's still the 6 feet distancing, it's still wearing masks can help protect folks. But if you're having a conversation with somebody within 6 feet, there's going to be a lot more virus coming out of their body, getting into your body, which makes it much more contagious and much more likely for you to get it. So now what we're seeing is that they are still really good, and what they're really good at, and this is like my key concept around the vaccine, you will notice that there are less people dying. There are less people hospitalized from COVID. And what the vaccines are really good at are preventing people from getting seriously sick from COVID, from being hospitalized from COVID, from dying from COVID, and from getting long COVID. So long COVID can happen actually after. It can happen, well, obviously, it's long COVID, so it does happen after, but new symptoms can come up after someone recovers from COVID. So not only can they continue having the symptoms they already had, but they can actually start having new symptoms that can last for, we've seen months, we've seen, over a year. So, and some of them are mild and some of them can be pretty intense. So if someone gets COVID, when they're up to date on their vaccines, and I'll explain that term in a minute, they're usually going to get a mild case of COVID. So I got COVID. I was sick. I mean, I felt really bad, but I wasn't hospitalized, and I did not die from COVID. And we're going to talk about, somebody asked about the difference between pandemic and endemic, and we'll talk about that. But the hope is with enough immunity that it will start being more like cold. That's when it will move into an endemic. And then the vaccines and boosters also make people less contagious when they do get COVID-19. So they not only keep us alive, they help us have more mild cases when we do get COVID, but they do help spread the virus. So again, in the beginning, they were better at protecting us from getting the virus, but with the variants and the strains and mutations, they're still good at helping us prevent passing the virus. And we do expect to see people get COVID. We expected that in the beginning as well, because COVID, no vaccine is 100%. Although again, these were the most effective vaccines we had in the beginning. So we could have prevented this had we had a global public health strategy in place. Other questions so far? All right. A lot of folks haven't heard of Novavax, so I just thought I'd really quickly say Novavax is a new on the market, allowable in the US vaccine. It's a 2-dose vaccine. You get 1 dose, 3 weeks later, you get the second dose. There's no approved booster for the Novavax vaccine, but people actually now can get this new Omicron booster with Novavax. So that's new information. And we do have Novavax here in King County. We do a mass vaccine site at the Auburn Outlet Collection. So I always feel funny saying that, like I'm sending you to a shopping mall. And then not a lot of providers or pharmacies have it, but we've heard that they do have it locally at Costco. It is another mRNA vaccine. So again, the 3 that we recommend are all mRNA vaccines. Moderna, Pfizer, Novavax. And then we've stopped recommending Johnson & Johnson. And the reason is, there's 2 reasons. One, they're less effective against these new strains. So the Johnson & Johnson one does not work as well against the new variants that we have of COVID. So Omicron, we saw it starting with Delta and then Omicron. And then because Omicron was so prevalent and so many people had it, Omicron itself started creating what we call subvariants. So they weren't different enough from Omicron to call them their own variants, but they're BA4 and BA5. When you hear of those are subvariants of Omicron. And the reason that those have been so detrimental is that they are extremely contagious, and you can get them again, and you can get them again. We've seen folks get it again within 12 days. So that's new. I will say COVID, we have a lot of viruses that are pretty dumb. COVID seems to be pretty smart. it's not only, I mean, all viruses mutate and change. This virus mutates, and Delta was more contagious and also more dangerous. Omicron was even more contagious, and it wasn't more dangerous, but because there were so many people who got it, our hospitals were full. And now it's mutated to subvariants that can actually bypass immunity. So it's a pretty smart virus in that way. And then we also don't recommend Johnson & Johnson because they do have more rare side effects than we see with Pfizer, Moderna, or Novavax. So people can still get it if they do not want an mRNA vaccine. I will say once they're in the body, they really do work very similarly. It's just that one, Johnson & Johnson is sort of the, excuse me, the vaccine that folks are kind of used to. And then the mRNA vaccine is like a newer, it's not new to us. We've been using mRNA technology in our bodies for decades, and have been using it for cancer treatments and other treatments as well. So we do know what it does in the body. We do know it's safe. We do know it doesn't change your DNA. But I think because it was a new technology for vaccines, people were really wary of it. But once they get in the body, they both Johnson & Johnson and then the mRNA vaccines really do the same thing. They train our bodies to recognize this new virus without us ever having to get COVID-19. I've talked to so many folks who are like, I have a very strong immune system. I'm not going to get it. And the reality is you can have a strong immune system as anyone. And when a virus enters your body that we've never encountered, we're not going to have the ability to fight it off. So it's not about the strength of our immune systems. It's about our immune systems needing to recognize it and get trained to fight it when we get it in the body. So the vaccines are nice because it helps us fight it without ever having to get sick from the virus. And then when you get the vaccine, your immune system makes antibodies. And actually, we always talk about the antibodies, but it also does other things as well, like help fight the virus with T cells in a similar way that HIV, that similar way that if someone gets HIV or other viruses, our body creates an entire immune response to try to fight it. But one of the things it does is create antibodies to protect us. And specifically what happens with COVID virus is you see the little spike proteins on the cell. It creates these spikes. So the vaccines teach your body to recognize the spike and to recognize it when or if we get COVID and create antibodies to fight it. So now our bodies are prepared to fight this virus when we get it. And it teaches our body how to do it. Questions? There's no magnets. There's no changing of DNA. There's no trackers. Just going to dispel some of the myths that are out there. It does not cause infertility. It does not harm a pregnancy. Actually, COVID is extremely dangerous for folks who are pregnant. When folks are pregnant, their immune systems are weakened, so they're immune compromised, and much likely to end up dying on ventilators in hospitals if they get COVID while pregnant. And when they get the vaccine, they're much likely to have healthy pregnancies and also share their immunity with their, like during the pregnancy and during breastfeeding or chest feeding. I like to make sure to mention pregnancy because one, I come from the sexual health world, and two, folks who are pregnant are severely under vaccinated, and it's a lot because of the myths or the the misinformation and disinformation campaigns that are all over social media. So COVID, extremely dangerous for pregnant folks during the pregnancy and for up to 2 months after the pregnancy. And then if they get the vaccine, they are protected against, like I said, severe illness, hospitalization, death, and also they're sharing that immunity with their pregnancy and also through breastfeeding. All right, I'm gonna keep going past these because I think you get the point of how vaccines work. All right, and so if the vaccine works, why do we need a booster? Again, I'm going through a lot of the questions that we got in the list that I received. So the reason we need a booster is that with many vaccines, we need boosters. You know, tetanus, you need a booster every 10 years. So with COVID, what we know is a protection from the initial, your primary series is what we call it, but the initial doses you get do decrease over time. So the booster shot is going to boost that protection and immunity. So the boosters are really important to keep folks' immunity up. I will tell you, the boosters, people are sick of it. People are tired of COVID. They're just over it. And so we had the best rates in the country. We hit 70%, 80%, like first in the country. Our booster rates are less than 50%. So if you think about it, if someone got vaccinated a year ago, a year and a half ago, their protection is going to decrease. You walk into a restaurant with no mask, and everybody sitting in the restaurant also has no mask. They got vaccinated a year ago, and 55 of them are not boosted. It's going to cause folks to be much more likely to get the virus. So boosters are super important for folks who choose to get vaccinated. I know you all are deciding whether or not to mandate, being up to date. It sounds like there was already maybe, or even mandate being vaccinated. So I'm going to talk about when people choose to get vaccinated, and that's up to you all to decide around mandating or not. But I will say that the boosters really do enhance and restore the protection against COVID, especially this new booster that we have. Again, they make people less contagious when they get COVID and if they get COVID. And again, if they haven't been boosted and they were vaccinated a long time ago, they're going to be more likely to get more sick than if they're up to date with their vaccines. You can stop me anytime and ask questions. So I did put the schedule up here. I have it two ways. I have it in a chart and I have it in writing. What do you prefer, chart or a list? Just give me like thumbs up if you want the charts, thumbs down if you want the list. Chart? All right. So here's a schedule for vaccination. I don't think we need to go through it too much, but the thing I do want folks to know is that we're going to talk about this new Omicron booster. But you can see, how many weeks apart folks are supposed to get their boosters, get their primary series, and then the booster. Folks who are 12 and older can only get Pfizer. The bivalent booster or Omicron booster does come in Moderna or Pfizer. It's recommended for folks who are 12 and older. And then 12 and older, they can get Pfizer, but the Moderna one has not been allowed for use with folks who are under 18. So primary dose should be 2 shots, again, either with Moderna or Pfizer, except for folks who are ages 6 months to 4 years. The Pfizer one is 3 shots. The Moderna one is 2 shots. Originally, Pfizer was going to ask for approval at 2 shots, and what they found was that it worked much better with 3. So they waited a couple months and got more research and then asked for approval. So Moderna and Pfizer with adults, who you are going to be 2 shots. The same thing with Novavax, 2 shots. And then again, we don't recommend Janssen, which is the Johnson Johnson. Johnson Johnson was supposed to be 1 shot. They called it 1 and done. And then we learned you needed to get your booster within 2 months. So not really 1 and done. Folks who are immunocompromised, either moderately or severely immunocompromised, do need an extra shot. And I think this is critical, and folks aren't usually aware of it. If you go to the website for the CDC and you look up who they consider would be immunocompromised, moderately or severely, every single item on that list is severe. So I'm just going to say anybody who's immunocompromised, moderately or severely, needs actually 3 shots in their primary series for Pfizer or Moderna. And the 3rd shot would be 4 weeks after their 2nd shot. So I am not immunocompromised. I had 2 shots that got me from my initial series, that got me vaccinated here. My mom is immunocompromised, 2 shots got her here. 3rd shot's going to get her up to the same level. So that list is, again, severe. You know your bodies, you know whether or not you are immunocompromised. And again, folks who are pregnant are considered immunocompromised. They are not on that list. So it's something to just keep in mind that folks do need a 3rd shot. That's not the booster. That is to get what we saw were the folks who were getting COVID and had been vaccinated, who were being hospitalized or dying, were folks who were immunocompromised. And I will also say that folks we see who are immunocompromised are often, there's higher rates of immunocompromised folks who are women. So it is really important to know that you do need an extra dose. All right, and this is the same thing. This was just the chart. So Moderna and Pfizer both came out with this bivalent booster, also called the Omicron booster. There were questions about it. So the thing to know about it is it's called a bivalent vaccine because it contains the original vaccine, and it also contains so half of it is like targeting, it's the original vaccine, and then half of it is targeting BA4, BA5. Like I said, BA4, BA5 can bypass immunity, so this is training our bodies to fight it, and so it can't bypass previous immunity like it can when people get it. When people get COVID, the vaccine is training our bodies to prevent getting it. And again, it has the same ingredients. There are very few ingredients. I'm happy to answer any questions about the ingredients in it. I will say that for folks who keep kosher, for folks who are halal, there's no animal product at all in this. And there's usually around 10-ish ingredients in Moderna and Pfizer, and each one serves a purpose, so very minimal. And each one serves a purpose to allow our bodies to accept the vaccine. And then the mRNA molecule, and in this one, the 2 molecules, will actually disintegrate pretty rapidly in the body. So there's rumors or misinformation going around that the mRNA is going to stick around and you can use it for tracking. But if you remember when they came out, there was all this talk about having to keep them very cold. And that is so the mRNA molecules did not disintegrate. So when they get in our body, they are not going to stick around very long. They are going to disintegrate. And then how many boosters are we going to need? How often are we going to need them? I don't know. This is still something that we're learning. This is our first booster that was created specifically for a variant. So we don't know how many more variants and subvariants are we going to have. We don't know. What we do know is the more virus in the world, the more virus in people's bodies, the more it mutates. This is where it becomes a public health crisis. So, you know, most of the variants we're seeing, even though there's a lot of virus in our country, we're not usually seeing the new variants coming from our country. We're seeing them come from countries that don't have access to the vaccine. So impoverished countries are not able to have the vaccine, or they have substandard vaccines. And so this is where we're seeing the variants come out of. This is where it becomes a global health crisis and issue. So these are some of the additional questions that I received. You'll recognize them maybe. I did shorten some of them, but I kept the ideas in there. So one of the questions was, are we still in a pandemic? What's the difference between a pandemic and an endemic? I know Biden just came out and said we're in an endemic. I don't know that, you know, public health would agree with that. So even though all the regulations have changed regarding mandatory masking and distancing, we are still in a pandemic. And the reason that we would consider it still a pandemic is that a pandemic, the question was, what's the difference between an endemic and a pandemic? A pandemic is when a disease's growth is exponential. So the rates can be really high and cases continue to grow. Right now, we don't know how many cases of COVID we have. All we know is how many cases we have in King County when people went to go get tested at a site. But as you know, most people are doing home tests now. So we don't have accurate information. We have accurate information about hospitalizations and deaths, but we do not have accurate information about how many people have it in King County. Also, in being declared a pandemic, the virus, it doesn't have anything to do with virology or the severity of the disease or immunity. It has to do with how much of it there is in a wide area and how many countries it's affecting and how many communities and populations it's affecting. Well, this is a global epidemic, right, or global pandemic. So that's where, that's the definition of a pandemic. An endemic is when the disease outbreak is consistently present, but not limited to a particular, but is limited to a particular region. There's a hand up. Governor Carla?
Thank you. I have a number of questions, but I didn't want to interrupt you if you want to
you're-
finish your slides first.
No, you're welcome to interrupt me.
All right. Well, thank you very much. I do have a number of questions, and I wonder if you might have some comments. First of all, do you happen to know how the current death rates for COVID compare to death rates for influenza?
We've seen, well, so currently the death rates have been low because we've done a great job here in King County. The death rates have been low because we've done a great job of vaccinating and also boosting folks who are over 65, who are more likely to die from COVID due to underlying health conditions. Also in King County, we have made a concerted effort to make sure to get the vaccine out equitably, meaning that the communities who've been the hardest hit, so highest death rates, highest hospitalization rates, have been folks from BIPOC communities, so Black, Indigenous, I'm going to say Latinx, and then also people of color communities, and then also LGBTQ or lesbian, gay, bisexual, and transgender and queer communities. And this is not due to anything wrong that they're doing. It's due to the fact that homophobia, transphobia, and racism cause underlying health conditions. So those underlying health conditions cause death and hospitalization rates to be higher. So we've seen the death rate go down, but during Omicron, what we saw was our hospitals were full and the death rates were going up. So overall, the rates of COVID compared to flu are exponentially higher. And so the concern is what's next, right? Like right now we have the Omicron booster. We're all very excited about it. And we also know that this disease in King County is, we are able to prevent death, and we're able to prevent hospitalization. But in countries where there are no vaccines, that's not the case. So the rates of death from COVID are exponentially higher than the rates of death from the flu.
Okay, thank you. President Biden recently declared that the pandemic is over. I wonder what your response to that is.
This is my response. You know, I think a lot of people like want, so an endemic would be when this becomes, actually I have, so there's a study out of Yale that answers that question. So basically we have a lot of natural immunity, or we did from Omicron, and we, again, BA4, BA5 can bypass that natural immunity. Natural immunity meaning people get COVID and their body has some natural immunity for a little while. The difference is that the COVID vaccines will actually train our bodies how to fight it off and recognize COVID for longer. So natural immunity can last and can be great, and it's much more limited. And then BA4, BA5 can bypass that. So the new Omicron booster was created specifically to prevent them from bypassing it. But what we see is, you know, when people start getting COVID, it becomes more just like a mild cold. That's when I would say it's going to become an endemic. However, and we are seeing a move towards this becoming an endemic in the US. However, we're a global community, sorry. And that's the piece that puts like the stability of it being an endemic at risk. So we really do need to stop thinking about ourselves as an island, right? And think of ourselves as a global community. Because again, as I've mentioned, where we are getting these variants are impoverished countries, and that is not they are not to blame. The blame is that they have no access to vaccine. So this would be what I would say. I mean, the Yale study found us moving towards an endemic, and possibly 2 to 4 years. I've heard 2 years, I've heard 4 years. But I wouldn't, you know, I'm not going to disagree with the president. But I will say that, you know, we don't see ourselves there yet. We are trying, like public health is trying to move towards this being an endemic, and also treating, like, we know that this is here and this is here to stay. So that's the piece where people see it as an endemic, but we don't know what's to come in terms of new variants and new, yeah.
All right, so
Does that help?
Well, I appreciate the information. I do have, Mr. President, I did have a couple more questions. Is all right? I don't want to monopolize this speaker if others have questions, but I do.
Well, if you want to hold your questions, that's fine, but I want to make sure you have the opportunity to ask your questions.
Well, I do have a couple more, if I might, then. I was reading a recent study that was commissioned by Moderna that found that the updated COVID-19 booster, which contains elements of the Wuhan virus strain and the BA1 strain, is not more effective than the old booster. This was published in the New England Journal of Medicine. Are you familiar with this study?
So what I can tell you is that the new booster, they are still learning the effectiveness of it. The trials that they did originally were in mice, and we're still learning. And then they started doing trials in humans. And so we are still learning the effectiveness of it. But it does contain, again, the original booster, like you mentioned, which again is an effective booster. And the fact that it targets BA4 and BA5, I'm more excited about than BA1, because BA4 and BA5 are the ones that people can, and right now BA5 is the biggest one that we are seeing. And so that is and they can bypass the previous immunity. So with the new Omicron booster, it can train our bodies to not allow that to happen, which is super important.
So to follow up on that, the New England Journal of Medicine article did say that increased neutralizing antibody titers, as well as clinical effectiveness, have been shown to wane by 4 months after a third messenger RNA immunization, and after the fourth, protection has been reported to wane after just 4 weeks. And they say that hybrid immunity from vaccination and infection provides greater and more durable protection than either alone. Would you agree?
The studies I've seen about the greater protection from having having COVID will give you natural immunity. We don't recommend getting the Omicron booster until 2 months later. And we can talk, there's several reasons around that, or 2 months after your last booster. The sort of super immunity idea that people were talking about, or this idea of having immunity from the booster and having COVID, I have not seen good studies since Omicron hit the scene. So all the studies I've seen that showed that to be true were pre-Omicron. And again, Omicron has been the most contagious, has had more virus, and has spread. I mean, we had highest rates of COVID that we've ever had when Omicron hit the scene. That was since the beginning of the pandemic. So, and we had highest hospital rates. So, yes, having had COVID, you have some natural immunity. The vaccine immunities do last longer, and the studies were before Omicron. So that's what I'll say about that.
Okay.
Also, I would much prefer people to, the difference between also the natural immunity and immunity from a vaccine is that when you're not vaccinated and you get Omicron, that's when we were seeing, again, higher death rates, higher hospitalization rates, severe illness, and long COVID. Whereas if you are vaccinated and you get, or you're up to date on your vaccines and you get COVID, that the vaccines and the boosters will protect you from that. So there's a lot of folks who were like, let's have COVID parties. Like back when I was a kid, they would do chickenpox parties. Well, the difference is COVID is much more dangerous. So having COVID versus being vaccinated is going to be always going to be safer than getting COVID.
Thank you, Mr. President. I'll stop at this moment. I may have questions later.
All right. So somebody asked if the goal is to stop the spread of the virus, is the most effective method masking, social distancing, staying home isolated, and quarantining when you are sick? Yes, those are extremely effective methods. Here's the problem, is that there are many ways to stop the spread of COVID-19. What we know is, and again, like public health mandates the vaccine for its employees. I don't like mandating because I think that people, we've seen many times throughout history where people are forced to get injections into their body that they don't want. Or have been experimented on. And there's lots of cultural and historical trauma, racism, and current today trauma and racism and forced many things like forced sterilization, forced testing on folks. So, I think we have a lot of reasons not to trust the government, not to trust medical, and I work for the government and I work in the medical community. So lots of great reasons not to trust. And so, for me in doing education, what I hope is to dispel the myths. And I am not arguing for, mandating. So yes, those are great ways to stop the spread. The problem is not everyone's doing it. Everyone has to do it for it to work. So one, people are contagious 2 days before they show symptoms. So that's problematic. You can go to work, you can go hang out at a restaurant, you can go with your friends and you feel fine, but you have COVID. And you're contagious. So the flu, you're contagious 24 hours before, and with COVID, you're contagious 2 days before. Another problem with that is that about 40% of people with COVID have no symptoms. There's different studies that have shown difference, and today the most recent studies show about 45% of people with COVID have no symptoms. And then people say, well, isn't that fine? Well, the concern is that you're passing it and you don't know it. And so you can be passing it to an elder, you can be passing it to somebody with underlying health conditions. You also could get long COVID. So you can get symptoms in a couple months. Many people don't test. My brother's whole family had COVID and he works in a school as a speech therapist mainly in a school that has high poverty rate. And when you're a speech therapist, you're working with folks with a lot of autoimmune or immune compromising conditions. So he thought he had allergies. He did test, but he didn't wear a mask. So he tested, he was negative. Sometimes it can take a little while for it to show up on a test. You have to have enough virus in your body. Your body is trying to fight it. So this is why sometimes home tests aren't as sensitive as PCR tests. And your body is trying to fight it. So sometimes it can take a few days. This is why we say if you're exposed today, wait 5 days or wait 3 days. And then if it's still negative, test again at 5 days, because it can take a little bit to show up on a test. And then wearing a mask is great protection for the person next to you. Wearing a mask is good protection for me, but I still got eyes. My eyes are bigger than my nose. So my partner wearing a mask in line for 20 minutes at the pharmacy, and they brought home COVID. So masks are wonderful protection when everybody is masking. But unfortunately, when everybody is not masking, you're doing a wonderful job at protecting your community and protecting the people near you when you are masking. And you are also protecting yourself, but not as much as you're protecting them. So yes, all of these strategies that folks talked about are great when everybody is doing it. People did not like the mandates. People were really mad about the mandates, but really, they work really well when everyone is doing it. But not everybody's doing it. People are still going to work and school when they have symptoms. Oh, it's just allergies. Oh, it's just a cold. And not testing or not wearing a mask when they have those symptoms. Oh, we had a hand up.
Thank you. Thank you. So I'm one of the people that maybe submitted this question. And I guess my point is where does being vaccinated stop the spread? I mean, everything I've heard about the vaccine is about how it changes your own response to how you get COVID. I mean, I'm sitting in a room with 26 people and only 5 are wearing masks.
Mm-hmm.
And so what is, if the other 21 people have COVID right now, what is it doing to, what is their vaccine status doing to protect me?
So vaccines and boosters do make it harder to get the illness. Again, they were better in the original alpha, right? But they're still good at preventing COVID. They're better at preventing death and illness. And they do make people less contagious when they have the vaccines and the boosters because they're going to have less virus in their body. So if everybody were up to date, like I said, in King County, I haven't looked at the numbers this last 2 weeks. I would guess we're probably at 45% maybe. They're not changing very rapidly. So maybe 43% of folks are up to date with up to date on their vaccines. So some people could have been vaccinated a year ago, a year and a half ago, 6 months ago, and all of that. So not being up to date on your vaccine is going to make someone much more likely to get COVID and much more likely to pass COVID. So I still mask when I go places, you know, and again, you're in a room full of people and I can see that you're all sitting pretty close to each other. So if somebody does have COVID and they're masking, they're protecting the other folks. However, we consider exposure being within, even with a mask on, being within 6 feet of somebody for 15 minutes in a 24-hour period. That could be 15 minutes throughout the day. That could be right now, your hour, you're all, if one person has it, you would be considered being exposed to it. So the vaccine, I put this one back up to remind us that the vaccines and boosters do help people be less contagious when they get COVID. It also does help us prevent getting COVID. And then this new Omicron booster, since BA.5 is the most prevalent here in King County. Again, it takes 2 weeks. So if someone has to get the booster and then 2 weeks, and then they're up to date with their vaccine. This new booster, we're still learning about, but the nice thing is that it specifically targets these subvariants that without that booster can bypass previous immunity. So do I wish we still had a mask mandate? Absolutely. I don't think my partner would have gotten COVID, and then I don't think I would have gotten COVID had we had that mask mandate, but we don't. So you've got how many people in the room you said wearing masks?
6.
Okay, so you're wearing a mask, you're protecting your neighbor. You're also protected, but I've started wearing my glasses everywhere I go. I mean, my glasses are not going to protect my eyes as well as the person next to me wearing a mask, but a mask and my glasses, maybe they'll help protect my eyes a little bit because the eyes are an entryway into your body, right? So yeah, if everyone was wearing a mask, there'd be much more protection, but that's not the case. So
Right. And I just want to be really clear. I tried very hard not to ask you questions on the policy on where to go and what to do. I was just trying to get to the science. And this is the first time I've seen, even the news hasn't covered vaccines as preventing contagiousness. Is there specific scientific data relating to comparison? You know, I mean, in the beginning, there was all these people that showing us how much your spittle happens when you don't wear a mask.
Yeah.
Is there anything that you can provide that gives us this scientific background about the lack of contagiousness when you are fully vaccinated?
Yeah, there's plenty of information about the lack of contagiousness. So, and again, it was the vaccines and the boosters were more effective with Alpha, but they're still extremely effective. I mean, if you think about vaccines, this is where I often have to do like vaccine education, because people think of vaccines and they think of them as 100%. They're not 100%. The idea is we get enough immunity in our communities, and that's what makes them 100%. The flu vaccine, for example, usually about 50% effective. So these vaccines are extremely good even today with the new variants, but they're not as good. And yes, they do protect the spread, and they do lessen the spread when someone has COVID. And then the new booster, the fact that it has contained the previous booster, previous mRNA, and the one that targets BA4 and BA5 is extremely smart, because the other boosters were effective as well. The problem is, again, if someone had their original primary series a year ago, their immunity has waned. Their immunity has gone down. And they are not up to date on their booster, or they're not up to date with their vaccines. So let's say someone has tetanus and they were vaccinated 12 years ago. Well, their immunity to tetanus has waned. You're supposed to get it every 10 years. So they're going to be more likely to get tetanus than if they got their vaccine 8 years ago, right? So this is the issue with the boost. Like, yeah, everyone's tired of it. And we're going to be much more likely to see it go away if 42%, 43% of people boosted is an extremely low number. I think about it as you walk into a restaurant and you look around, and 55% of those people, their immunization has waned to, their protection rate has waned. And it depends on if they're 6 months or if they're a year, how much it has waned. But yes, there are scientific data and studies that show the vaccines work, they're effective. Today, they do still help prevent passing COVID. BA4, BA5 are unique, not unique, but are extremely problematic, that they can bypass previous immunity. So having this new booster is extremely exciting, that they were able to create one that will work specifically for them. But what's coming next, we don't know. And that's where the global crisis, or thinking of ourselves as a global community, would really benefit us as US citizens. So yeah. So do they prevent? Yes.
Yeah.
Do they work as well to prevent as they do to prevent you from dying? No.
Okay, I have a bunch of people that have questions, but I just wanted to know if you wanted to take the questions now or if you want to take the questions
Yeah,
later.
let me get through because other folks had submitted questions, so I feel like it's kind of only fair to them to let them get their questions answered, and then we'll move forward with the other ones. Is that all right?
Yeah, I'd like you to do your presentation, and then I've got
Yep.
several people that want to ask questions. I've got
Yep.
Governor Williams-Ruth that wants maybe some more.
Yep.
Are you all done? And then I've got Governor Peterson. You had your hand up earlier. Do you still want to ask questions? Okay, so you're first in line. Then comes Governor-elect Kevin Fay, and then Governor Stevens.
Okay. So yeah. So are there things that can make us safer right now? And the answer is yes. Masking, I mean, this is what, masking is great. Again, it's better when everybody is doing it. Being outdoors is always going to be safer because because you're outdoors, and there's not just like stuffy air sitting around. There's much better ventilation. Having windows and doors open, if that's safe, which is not always safe for folks. Having really great ventilation and like HEPA filters. Consider testing the day you are going to. So if you all tested this morning before coming together, that can be helpful. Again, a negative test, home test, does not always tell us whether or not you have COVID. A positive test, you have it, period. But you have to have enough of the virus in your body to show up in the test. Also, people don't always do the test correctly, but doing a test correctly and not having a lot of virus in the body yet can help prevent passing it. So testing before being in group gatherings is a good idea. Always isolating and quarantining when symptoms develop, especially if they've been exposed to COVID-19 and they know they were exposed. If someone has allergies every single day of their life, that's not a new symptom. But if all of a sudden someone wakes up one day and they're sneezing and they're coughing and their eyes are running, well, you're going to want to quarantine. You're not going to want to go into a space with other people. You're going to want, and testing when someone has symptoms it's more likely to show up when people at home test, when people have symptoms. But again, I would still recommend wearing a mask if you do have symptoms, so that you're protecting the people around you, and then continue to, I would test again in a couple of days. And then if you have COVID, it doesn't count if your fever is gone because you're on ibuprofen. So if you had COVID and you want to stop isolating, your fever has to be gone after 5 days. You're not without medication, you're not getting new symptoms and your old symptoms are improving. If all of a sudden you get a new symptom, now you get diarrhea, now you get chills and a fever, or well, you already have fever, but now you get chills, now you get your throat starts to hurt, then you would continue to isolate for 10 days. But if your symptoms are getting better, your fever is gone without medication, that's when people can stop isolating. But again, they'd want to wear a mask in public for another 5 days. And then outdoor activities, again, are always going to be safer than indoor activities because of the mass ventilation and dining outside, and then wearing a really good quality mask. So, I still see people wearing gaiters or handkerchiefs, and they're not good quality masks. If I can see your mouth through a mask, that's not helpful. So the ones that are really helpful are going to be N95s, KN95s that are actually been, you can get tons of them online that have never been tested. So you want to make sure that it's actually accurate, that's a KN95. And then also wearing the surgical masks. They're multi-layer, they're really helpful. And then again, remembering our communities around us, that we have children under 6 months who aren't eligible to be vaccinated. There are people who can't get vaccinated due to medical reasons. There are folks who are immunocompromised around us that we may not know. I mean, we think we know everybody who's immunocompromised. We don't. We don't know when people are immunocompromised. We don't know when people have disabilities. So keeping in mind that we're also needing to take care of each other. So yes, there are ways to make things safer. And I think that's a really great question that was asked. The hard part is that it really does have to be a community-wide effort and not just the 6 people. And then someone asked if the policy states that someone must be vaccinated and boosted, does this Okay. The policy states that someone must be vaccinated. This is inherently, isn't it inherently a permanent prohibition against anyone who did not get the first round of vaccine? And the assumption is that there is no longer the original vaccines. So to answer that question, generally speaking, no, we still have the original vaccines. You can still go get your primary doses. You can't get a booster until you've had your primary series, but the primary series still exists. So you can choose Novavax, you can choose Pfizer, you can choose Moderna, you can choose J&J. We don't recommend it. And as long as the policy, again, if you choose a policy, allows for that timeline. So Pfizer, the doses are 3 weeks apart. There's actually some evidence that shows a little longer is better. Moderna is 4 weeks apart. And then you're up to date with your vaccine. You don't need a booster because you're not eligible for one yet. So once you've had those 2 shots and 2 weeks later, because the second shot, you still need 2 weeks before you're fully vaccinated, you're fully vaccinated. And then when you're due for your booster, that's when you get your booster. Again, if someone's immunocompromised, they want a 3rd shot 4 weeks later. That's not a booster. So generally speaking, no. The policy allows for that timeline for someone to get either Moderna or Pfizer. They are now fully vaccinated and they're up to date with their vaccines. And then when they, and someone else asked, what does it mean to be fully vaccinated? What's the difference with that and being up to date? And the term we're using, up to date, now is because fully vaccinated we're using when people had the initial series, and up to date means that you're where you're supposed to, like, you're in that timeline. So if you just got your 2 shots and you are not due for a booster, you're up to date. If you had your 2 shots a year and a half ago, you are no longer up to date. You were fully vaccinated back then, but you're not up to date with your schedule, if that makes sense. So it's misinformation that the original vaccines do not exist. It's misinformation that they're not effective. Again, they're still effective, and they're way more effective than many vaccines that we have. And again, the idea is we have to get enough people up to date and vaccinated in order for us to eradicate this illness. If the illness has nowhere to go, if everyone is all immune to this, and the virus has nowhere to go, it's going to stop creating new variants. Again, that's where the global issue comes in. What we need to do is be fighting for impoverished countries to be able to have effective vaccines and boosters, regardless of money. So as long as the timeline allows for it, it's just a fallacy that the original ones are not around. Now the recommendation for booster, we're not even using, so it used to be the booster was the same shot you got in your original series. Now the booster is the original shot you got in your first series, or you can choose to switch. You can choose to, I did Pfizer, now I want to do, now I want to do Moderna. That's fine. But it now also includes the Omicron booster as well. So I hope that answers that question. And
Mr. President, if I can just interrupt, do you know where you can get this vaccine? Because I was actually trying to help one of my clients get it, and I called every pharmacy in the Federal Way in Auburn area, and the only place I could find the original series was at the University of Washington. So maybe it's not that it's gone, but it's not as readily available. And so I just want to be really clear, because again, I feel like calling it misinformation. I I take offense to the fact that I'm not spreading misinformation when in my community, getting the originals was extremely unavailable at CVS, Walmart, Walgreens, Safeway. I was doing that for my clients. And so
Yeah, so this is why we had mass vaccination clinics, and we still do. The Auburn Super Mall has the vaccine, the original and the boosters. We do clinics in communities, so folks can we do them in community organizations. I live in South Burien, and I got my, they're still doing the original series at all the pharmacies I've been to around here. So the original series isn't gone. Getting the Omicron booster, that is harder to get because people have to order it, right? But we do it at our public health centers. We do it at that Auburn Super Mall. And then that is one that in general, many private providers aren't doing these vaccines because they're not making money off of them, is one of the reasons. But but pharmacies are ordering this booster and are still continuing to do the original series. And all of our public health, so here's how you find how to get them. Let me pull it up. If you go to, and I can email you this, and all the links are live, but if you either do DOH or King County COVID vaccine, and get vaccinated in King County, you will come up with a whole list of here are the pop-up events we're doing. I don't know if you guys can see this. It's kind of small. Let me make it bigger. But there's phone numbers that folks can call. People can get free rides. We have in-home vaccinations that are free, and so for folks who are not able to leave the home, we have in-home vaccinations that are free. All vaccines are free. And then we have a list of, we have the Washington Vaccine Locator. So you can go in here and find where to get the vaccine. So, and it'll give you the list of pharmacies and what they have. So yeah, we still, there's tons of places that are still doing the original series and also the new booster. So, and we still have, we have less of the drive up vaccine sites than we do the testing sites, but we still do have, you mentioned Auburn, so Auburn Super Mall has is that what they're still calling it? And then here are the vaccination sites by cities. So this is just King County. The cities are doing, City of Seattle is doing them. So I got mine at the Eastgate Clinic in Bellevue. So you can look them up. Kaiser is doing them. So yeah, I would I'm going to put it in the chat. I would highly recommend going to our website and finding where they are. You can also still use that the Department of Health vaccine locator, and you can also sorry, there was a phone number on here too. So for folks who don't speak English and who would like some additional support. Oh, I did not mean to stop sharing that. I was just trying to find my chat. They can also call our, we have a phone line that folks can call, and I'll put that in here. And it's 8 to 5 every day. The state also has a phone line that folks can call. The thing I like about our line is you're going to get a human. And that if they need another language, we just connect right to a sorry, I'm having trouble putting in chat and talking at the same time. We connect folks to a language line, and we always have interpretation. So before COVID, worked out of the Eastgate Clinic. We saw folks who spoke over 52 languages. So we're really used to providing accessible healthcare. And then there are free rides. There's actually childcare through a number of places. If folks need to go get their vaccine, but they don't have childcare, there's free childcare, there's free transportation. We do in-home vaccines for folks who need them. And then not only will we vaccinate the person who can't leave their home, my goddaughter, her grandmother can't leave the home. The entire family was able to get vaccinated during that home visit. So yeah, I mean, so it's confusing to me, not that, I believe you, I believe that you were having trouble finding it. I also am putting this in here on purpose so folks can know how to find it. And then if you can't find one online, calling that phone number can help. And there is also, and you can go right online and actually, like, I got my appointments online. And I just found through the locator, I found someone that had it, and I got my appointments, the original appointments, and then my booster appointments. I've just walked into pharmacies and gotten them. So yeah, so both are available. And if you can't find them anywhere else, I would absolutely recommend the, any of these like pop-up events. So again, like we do community events, so we don't expect people to come to us all the time. Finally, for once, we are actually going out in community and to places that are asking us to come there. So people are requesting a vaccine event. Sometimes we're able to do vaccine, like routine children vaccines at the same time. Sometimes we're not. It depends on who the provider is. So we're not always the provider of the vaccinations. We're kind of like matchmakers. Someone applies to be a vaccine event, and we match them up with a provider who can provide them. And then sometimes they're also able to do routine childhood immunizations as well. And then schools have been offering them as well, these pop-ups. So, you mentioned, so here's Federal Way. I mentioned the Auburn one, Kent. There's a vaccine event happening at Utopia in Kent. So lots of places. I hope that's helpful. And again, I can email these, but our website, I feel like our website is extremely underutilized, but I will also show you, since we're on the website, you can see how many languages all of this information is in on the site. Like if you just click on the in-language materials, we have flyers, we have posters, we have the list of places where folks, if there is a child who needs a low sensory site, we have all of that information, and like right on our front page, vaccine information or get vaccinated. So it, yeah, you can find all that information on our site. There are hands up, so let me just, there were only a couple more questions. Let me just finish this. And again, I'm not advocating either way around policy. I'm just letting you know that there, if a policy goes into place, that a thing to consider would be allowing people the time to get vaccinated. The county, when they put the policy in place, the turnaround was like pretty short. I worked with businesses who on Thursday announced that everyone has to be vaccinated by Monday. Like that's, I mean, at least get their first shot by Monday or be fully vaccinated was another one like that. I mean, that's not a reasonable timeline. So sorry, I have allergies. So sorry. So, you know, you do want a reasonable timeline to allow for schools. And then there was a question of, is there talk of schools mandating vaccines? Well, schools have been mandating vaccines since last year. for all employees and all volunteers. So there is not a mandate for children, which is what the question was. And the question also was, will there be one in the future? And I have no idea. I mean, I never know what's going to happen in the future. What I do know is that all staff and all volunteers in schools and childcare must be vaccinated. And then, you know, they're recommending it for the request from Department of Health is for them to recommend for families to vaccinate their children. And a lot of that is to prevent a shutdown again, right? To prevent the spread. And also, a teacher cannot mandate masking in their room. If there is an outbreak, the district can decide that that school will mask and not all eat together and things like that for 2 weeks to end the outbreak. But an individual teacher cannot make those decisions. It has to be a school district decision. School districts do not like to be told what to do. So it has to be an individual, or it has to be a district decision. So they can recommend if again, not everybody wants to recommend the vaccine. Department of Health is encouraging that recommendation, but they're not required for students or attendees of childcare. So that puts that can put the teacher and the childcare provider at risk. But yes, they are mandated. The mandate, as far as I recall, is that they be fully vaccinated, yeah, and that not necessarily up to date with their vaccine. So that, again, that's where an issue can come in. And then I'll send this out. There's additional resources. We have a toolkit for schools to help support them in all this information. There's a school and childcare guidance and recommendation long. There's the brief one, and then all the information about how to get vaccinated, and then where to call for questions about the guidelines. So I mentioned I do a bi-weekly call on COVID. I had somebody, and a lot of folks wanted to know about the guidelines, so I brought in the experts on this to talk about it. So happy to share. I mean, this is kind of, I mean, you can go online and read the guidance yourself. And they come down from Department of Health. And then I think the last question I got, what I didn't really understand, it says, as a person who has never received a vaccine obtain the same level of protection going forward? And I'm assuming that means if they now get the vaccine, are they having the same level of protection as someone who got the vaccine previously? And the answer is yes, and yes, and we have new strains. And so Alpha, again, they worked better during Alpha at preventing the spread, but they still work to prevent the spread, and they're really good at preventing severe illness, death, hospitalization, and long COVID. So yes, folks are going, the vaccines are the vaccines. They haven't changed, except for now when someone gets the new Omicron booster, that one is going to specifically target our current strain, which is great, which is what the flu vaccine tries to do, but they're guessing every year, which is why they don't always work. We know what the current strain is, and so we know how to target it. And then a reminder, you mentioned your clients. So good reminder that vaccines are free and available to everyone, regardless of insurance, citizenship, or immigration status, and so is testing. And then I will send this out to folks because, again, folks working with clients, we have tons of information in many, many languages about COVID vaccine and about COVID and about the vaccine for children and teens. And then there's our website. All right, lots of hands up, so I'm gonna stop sharing.
Yep. I think we start with Governor Peterson because he had his hand up before any of the virtual hands were up.
Yeah, no, thank you for obviously coming today and doing this presentation. That was very helpful. The one question I had though is we adopted a policy over a year ago, and and the policies, and I thought at the time the policy was a really good policy, but obviously things have changed from over a year ago. So, the Washington State Bar Association, we have about 138 employees that work, directly for the association. And then we have about 1,000 volunteers that volunteer their time to the organization. And then we have, sanctioned, or maybe sanction is the wrong word, but, events that are related to the organization that encompasses, thousands and thousands of other members. And so while the policy, like I said, I thought was really good when we adopted it over a year ago, obviously the environment's changed a lot since over a year ago. So I think one of the reasons why we requested some additional information is how to look at our current policy now, given the fact that things have changed meaningfully since over a year ago. Thank you.
And the current policy is that people will be fully vaccinated?
I believe that's correct. And I believe the policy is that not only fully vaccinated, but they have to have all the boosters that they're eligible for. Is that correct? Okay, that's, I'm Executive Director Nevitt's saying yes. So,
okay. I thought that was a debate of whether or not.
So yeah, you have to be fully vaccinated, and you have to have every booster that you are able to get or is recommended. That's our current policy.
Including a booster, not every booster.
Well, any booster that somebody's eligible for. Right?
Correct.
So not everybody is eligible for a second booster. Not everybody, everybody here would be eligible, because none of you are children, would be eligible for the first booster. And then certain people would be eligible for a second booster. If you're not eligible for it, then you are up to date with your vaccine, and you've gotten what you're eligible for, you'd be up to date with your vaccines.
Right. So do you have any input as to, is that still the right policy? I mean, obviously you have access to what King County does, and you probably have access in your job as to what many other cities and organizations currently do within the state.
Yeah, and everybody is really doing things differently. My partner is a small business owner. They still mandate masking at their site. Some restaurants are still mandating proof of vaccines. Many are not, because they don't want to lose their customers. And unfortunately, one restaurant had a really big event, and then they had to shut down for 2 weeks because all of their staff got COVID. So, it's really up to you all to decide what level of safety you want when you're in person. When I go out in person and present, I am presenting to people who are not vaccinated. That's mainly what I'm doing, because that's what I do. So, I mean, you all are mandated to be up to date. I go out, I'm talking to folks in person who are not vaccinated at all. And so I request, I can't go to a school and mandate that they wear a mask, because I'm not allowed to do that. So then I will only do it virtually. If I'm going somewhere where I can mandate that, I will say, I'm happy to come and do a presentation, but everyone's got to be wearing a mask. We need to be socially distancing. If you're going to be eating, you need to walk away, and I want to be outdoors. Or I need to know there's really good ventilation. So I want to protect myself. I don't want my partner's business to have to shut down, right? And so it's up to you all to decide your comfort levels. Everyone has different comfort levels. Like I said, I would rather people get the vaccine because they want to get the vaccine, but I also think it's reasonable then that they would call in to a meeting and join during Zoom or through Zoom rather than be there. Because again, even wearing a mask, we consider it if someone has COVID who you come into, you're within 6 feet of for more than 15 minutes in a day, you're exposed. And you wearing a mask is wonderful. You're protecting your neighbor, right? So the big thing would be, you all have to decide what you're comfortable with. And like that, it just panned out so I can see like how close you all are together and there's no mask. And I would not come into that room and present me, but someone else might. And you all, again, have been vaccinated. And again, usually I'm working with folks who are not. So I'm like, we're going to be outside. We're going to do, so it's up to you all to decide. If folks don't want to be up to date with the vaccine or get vaccinated, then there should, or there could be, I don't believe in people losing their, at public health, if you didn't get vaccinated, you lose your job. And to me, that's not a choice. That's a coerced choice. To other folks I spoke to on HR, they're like, they have a choice. I'm like, it's not really a good choice. Like you lose your retirement, and you lose your job. So unfortunately, those are the choices, though, that people are making. So if there's a way for your folks to be able to call in during Zoom, then that person can decide not to be up to date and still call in. That to me seems reasonable, but if there's not a way to do that for all of the events that you do or for all the situations you're in, then that's going to put people at a greater risk of getting COVID. And really, if everyone else is vaccinated, but they get COVID and they get a mild case of COVID, or they get no symptoms, the person who's really at risk are the people who are not vaccinated and are the folks who are immunocompromised. So again, like I talked about global community, but you're also a community. And what we know is that the first folks who got vaccinated, that first 70% of folks, what they told us was one of the main reasons they got vaccinated was they wanted to take care of their community and their family and their friends and their elders. So that's the thing to think about is you guys are a community. What do you want to do to take care of each other?
Thank you.
There are 3 hands up. I checked my calendar. I'm way over time, but I'm fine with that on my calendar end, but I don't know where you all are at. So it's up to you all if you want to continue since I'm over time, but I'm fine to continue. So yeah.
Okay, I got some more people who want to ask questions. We got Governor-elect Kevin Fay, followed by Governor Stevens, followed by immediate past President Kyle Schicketti.
Okay.
Thank you,
Again,
Mr. President.
my question though is
Mr. Just, I have some very specific questions about meetings that the board or the Bar Association as a whole may or may not have for people to get in and what is safe for those people. I understand that even though one is double boosted and vaccinated, you can still get COVID. I know this because I did.
Yeah, me too.
I got pretty sick. And I also understand that in order to transmit COVID, there needs to be a particular viral load that the recipient would get in order to get infected. I, as a sick person with COVID, even though I am vaxxed and double boosted, I can still transmit COVID to people, yes or no?
Yes.
Yeah, absolutely. Anyone who has COVID can transmit.
Correct. Now, I also understand that people can have COVID and be asymptomatic.
Right.
So even though I am vaxxed and double,
of people.
even though I have the vaccine and I'm double boosted because I'm seasoned, I could have asymptomatic COVID and still have enough of a viral load where I can transmit the disease to someone else, which is why you recommend masking. Yes or no?
No, that's why I recommended I'm not recommending anything. You
Okay,
all
no,
need to
I'm
decide
sorry.
your comfort
You're not
level.
answering my question. My
Okay,
question is,
I hear
if
you.
I am vaxxed
You
and
need to
double
let
boosted,
me finish what I'm saying. So what I am saying is, to be safe, what we would recommend at the county would be to test before coming together. So do a home test, because if you have a viral load that's high enough to pass it, a home test should pick up on that viral load. I also got COVID being double boosted, but I was not hospitalized. I did not die. I did not get severe illness, and I did not get long COVID.
I understand, but you're not answering my question.
I am
Please, let me
answering.
finish. Let me finish. I am not worried about the person who is not vaccinated. I'm selfish. I'm worried about me. Is this person going to give me or the other people in the building or in the room COVID? So I am vaccinated, double boosted.
Mhm.
Is it possible for me to have asymptomatic COVID with a viral load large enough to infect other people?
And I have already answered that question. My
And the answer
is
is
yes. My
yes.
answer is yes. And my
Okay.
answer is that in order to keep, I'm not selfish. I want everybody in that room protected.
I
Right.
understand from a public
So-
health standpoint, that is what you want to do. I agree with that.
Well,
I'm
as a
talking
human,
about,
so
I'm talking about requiring what you need to require people to do in order so that they are eligible to get in the room.
so if folks, you can decide that when you are coming together, you can mask. You can decide when you're coming together, you do a home test before you come. And if that home test is negative, then you come to the meeting.
Okay, I understand what
if
you're saying from
I-
a public health standpoint. Let me ask one more two more questions, actually. One, because I am vaccinated, double boosted, but can still get asymptomatic COVID with a viral load large enough to infect other people. What is the difference that vaccination makes between me with asymptomatic COVID and an unvaccinated person with asymptomatic COVID? We can
Does
both
somebody
infect
else
other
want to
people,
answer
yes?
this question, because I've answered it multiple times and
I'm sorry, you did not.
I have.
Let me be
What
clear.
I said is, so Governor Alec is looking a little frustrated. So what I have said is that being boosted is going to reduce your risk of passing COVID.
How? If I'm sorry, assume I already have asymptomatic COVID.
Yep.
Assume
Even
that I
when
do.
you have COVID, being up to date with your vaccines. I mean, you might not like my answer, and not liking my answers does not mean I'm not answering your question. So
Is my viral load is the viral load out of an asymptomatic person who has COVID and a vaccine lower than the viral load put out by a person without vaccines with asymptomatic COVID?
So people who are boosted and vaccinated and have COVID are less likely to pass it. And that would be because you would have a higher immunity and your body can fight that viral load down. I mean, I can
But
talk
if you're
viral
sick,
load
you
all
still have a
day, I
viral
come
load.
from HIV. So you still have virus in your body and you can still pass it. Absolutely.
Right.
And
Okay.
you are less likely to pass it if you are up to date on your vaccines and you get COVID. You're
Even if
also
I'm
less
sick.
likely to get COVID from Governor Alex. Do you want to jump in? You're looking real frustrated.
And
So you are less likely to pass it if you
even though
are
I'm
up to
sneezing in
date.
their face, just the same.
I'm not suggesting no, because if you have symptoms, you should not be going to
Assume I do. Or I think I
Right.
don't have symptoms, but I'm asymptomatic. What's the difference? I either have the virus or
Well,
I
if
don't.
you think you don't have if you think you have symptoms, but you're
I have the sniffles. I think it's an allergy. Two people,
Right,
one
so
is
then
vax,
you
one
get that-
doesn't. They have identical symptoms. They have identical viral load in their body. But having the vaccine makes it less transmissible?
So what I have
Yes or
said
no?
is, what I have said is, I would really appreciate you being a little bit more respectful.
Okay.
So
I
it's
do have
not a
another
yes or
question
no. There's
on-
not a yes or no. So
On antigen
what I am
tests?
telling you is, if you have symptoms, we do not recommend going anywhere. We recommend quarantining and staying home, testing. And if you continue to have symptoms, then a few days later, you would test again. But we do not recommend people with COVID symptoms, which are pretty much most symptoms, leaving the house and exposing folks.
Oh, I
You
absolutely
are
agree.
all
I'm
coming
sorry.
Henry,
together.
like Faye, I've got some other people that would like
Yes,
to
I
ask
know.
some
One other
questions.
question on the efficacy
you
of
are
antigen
all-
tests.
Well, no, I think your time's up. We've got to move on. We're out of time.
The
pretty
last
quick.
thing I want to say is, if you are all coming together as a group in person, the other recommendation is make sure you have good ventilation. We have folks at Public Health who will help you with that for free. And we would recommend taking a home test before coming together. That is the best. I mean, unless everybody wants to mask and stay socially, I mean, you can also mask, remain socially distant, not be drinking, not be eating, things like that. Those are all options. But if folks are not willing to do that, doing a home test is pretty simple. Maybe moving your chairs a little further apart, pretty simple.
Mhm.
And do not go to a meeting when you have symptoms.
So my suggestion, for the efficacy of home antigen tests, if it's negative, you won't have enough viral load to infect someone else, or probably have a lot less. So that is the preferred alternative, which is the point I'm trying to make or get to.
It is the best alternative we have. If you are coming together in person as a group, doing a home test or doing a PCR test, but that can take longer to get the results. They're more sensitive. So you can do a PCR test, or you can do the home test the morning before you come. That is the best that I mean, again, unless you want to mandate masking and social distancing, you could also mandate social distancing and testing, right? But these are your best options. We have COVID, like we have this pandemic still happening. So yes, you can I got COVID double boosted. I was pissed.
Thank
And
you.
I got it from someone not wearing a mask.
Right. Thanks so much.
So
I've got two more people that have questions, and then we're going to finish because we need to move on. Governor Stevens.
Thank you, Mr. President. And thank you, Ms. Wright-Sees, for your presentation, first of all. So at the end of October, the governor is going to remove his emergency orders. It's fairly possible that the Supreme Court will also make changes to their orders. And of course, we heard, and somebody mentioned the president saying we're past the pandemic, which I side with you on that. I don't think so. And in fact, some of his health folks had to walk that back.
yeah,
Now, I understand, and I understand in your answers, you are not telling us what to do. But I'm wondering, just in terms of these orders about to be removed, will they also come with corresponding best practices that we should still keep in place? And the reason I ask that question is because I think there is a wide gap of people who think, oh, well, if it's all over, we can go back to doing anything we want. We don't have to require anything of anybody. We don't have to ask anything of anybody. We don't have to take any of these measures and and we'll be just fine.
Yep.
And I'm thinking that we're probably going to need actually more guidance, not only from your health department, but from the state health department and others. Can you speak to that a bit?
Yeah, I can absolutely tell you what to do. I prefer not to, right? But when you go to our website, I have changed some language to you should to you can, because I don't feel like, I feel like you all need to make a decision. But the things we know that will keep people safer is to be up to date. So the website will tell you you should be, and CDC will tell you you should be up to date with your vaccines and boosters. You should improve indoor air quality by increasing ventilation, including using HEPA filters. These are all your best practices. Everything I showed you, this is your best practice. The best practice includes being up to date with the vaccine. Best practice includes outdoors is always safer. If you're indoors, make sure you have good ventilation. If you can open windows, open doors, great. Get tested before group gatherings. Test and isolate if you develop symptoms. And then again, you're going to want to continue to quarantine and test again. So if you're continuing to have symptoms, we do recommend taking a test and then a couple of days later taking another test. If you come together, if you have no symptoms but you've been exposed to someone, you want to quarantine. So I can tell you, yes, you should quarantine. You should not go anywhere if you've been exposed unless you're wearing a mask. And then continue to test in that 10-day period. And if you show up positive, then you need to isolate. And a lot of it is politics, right? A lot of it is, the CDC changing their recommendations to 10 days to 5 days, unless you continue to have symptoms. It is politics. It is wanting to open up the economy again. But the problem is, like I mentioned, like a restaurant that the entire staff gets COVID, they're not opening up their business, right? They shut down for 2 weeks. If you have COVID, you isolate. My partner got COVID and I knew I already had it. There's no way they had symptoms and you're contagious for 2 days beforehand. And I absolutely believe they did not get it at work because they continue their mask mandate. We absolutely believe we got it from that pharmacy where no one was wearing masks except my partner and everyone was sick. So if you are sick, you, at the very least, you wear a mask. And if you become positive with COVID, you isolate, and we isolated until I became positive. And then after 5 days, if your fever is gone and your symptoms are improving, you're not getting new symptoms, then you can stop isolating, but you still want to wear a mask for the next 5 days. If you get a new symptom, then you would continue isolating or start isolating again. So, and then the next ones are to choose outdoor activities whenever possible, and wear a high quality, well-fitting mask. If people are wearing the mask that they wore a year ago, they're not going to be well-fitting masks anymore, right? Like they're going to be all stretched out. So, and then the best masks are going to be the N95, KN95, KF94. After that, the surgical masks are going to be really good. And then after that, people can wear multi-layered cloth masks. But gaiters, handkerchiefs, things like that, we do not recommend. So if you're asking me like, yeah, what are the recommendations that we still have? These are the recommendations we still have. So they're not requirements. But they are the recommendations. Oops. And if you notice, the first one is being up to date on all recommended vaccines and boosters. So again, no, it's not going to prevent somebody from getting COVID. It will give them a milder case. I was also pretty sick for 2 weeks. So I can't imagine how sick I would have been had I not been. That's the thing that like people often don't think about. Like how sick would I have been had I not been double boosted? And when we look at our hospital rates and our death rates, they are much lower than they were in the beginning. And I do worry about my community and communities around me, and especially folks who are immunocompromised, especially folks who are from BIPOC communities and LGBTQ communities who have higher rates of underlying health conditions because of racism, homophobia, transphobia, right? Not because they did something wrong. So, or the baby who is next to me in line at the grocery store who couldn't get vaccinated. So, or the child who can't wear a mask because they're autistic and they have sensory issues, right? So these are all things to consider. So yeah, we do have recommendations. These are the recommendations. Is that helpful, Governor Stevens? Yeah. There was another hand up. I don't see it anymore.
Governor Stevens, do you have any other questions? No? Okay, thanks so much. Immediate past President Shichetti.
Thank you, President Tollefson. And I want to thank the speaker as well. A lot of good information today. I think exactly of what we had in mind when we asked for this at our last meeting. Some of the things that jump out at me and repeatedly stated is vaccination boosters make people with COVID-19 less contagious. And this helps reduce the spread of COVID-19. I removed my mask because one, it's harder to speak, and we're in a different situation here when we're doing in-person meetings, and we're trying our best to do as much as we can to protect ourselves and our fellow colleagues. So we're taking mitigation measures at times, and I try to wear my mask as much as possible for my own protection, also for the protection of others. But I don't fault people for not wearing a mask. Many reasons why people don't do that. But where we are is we're trying to determine whether this policy that we adopted a year ago is still viable, is still something that we should enforce, and whether we should make some changes for it. And so, you know, I came into this meeting thinking that, you know, at some point in the future, we're going to have to change, and we will have to change our policy, and we'll have to move forward because, you know, things change, and maybe it's time. But the more information that you share with us about, you know, protecting others, that we're still in a pandemic, that the best way to protect us against the spread of COVID-19 is to be up to date on vaccines and boosters. And then the problem is not everyone is doing it. That's the problem. If everyone was doing it, we might not be where we are right now. But again, you know, and I want to thank you and sympathize with you as well, that you are in a room full of lawyers who that can sometimes be very difficult and taxing, and you've been very patient with us, and I appreciate that. But
I do sexual health education prior to COVID. Trust me, I'm used to people being real mad at me.
well, it's appreciated with us. So really what the bottom line is for most of the people in this room is what they want to know is, should we change our policy? And I expect that, you know, there's a item on our agenda that it says review volunteer vaccination policy. So we'll probably have our own discussion about that and everything that you said today.
Well, I will tell you from a CDC standpoint and from a public health standpoint, the recommendation would be to mandate vaccine. I work with many communities who have a lot of historical and current trauma and have legitimate reasons to not trust government. like Marshallese community, we tested our atom bomb on their land. Why should they trust us? Right? So I get that people don't trust government, don't trust medical community, and there are a lot of legitimate reasons. But what public health would tell you and what CDC will tell you is staying up to date on your vaccines is the best way to prevent COVID. And then all of these other things are also ways to protect yourself and each other from getting COVID and passing COVID.
Thank you for that. And then, so Governor Stevens asked my second question, which would have been best practices moving forward. But my first question was going to be, on October 31st, the state is doing something, they're rescinding something. What is the state doing on October 31st?
I have no, I don't know the answer to that question. I know what everybody else knows. So oftentimes, yeah, I don't know. I mean, have they released what they're doing? Have they said what they're doing? Because I haven't heard that.
They
Yeah.
said something about rescinding the emergency restrictions, and it's been in press releases, but I don't know what the emergency restrictions are. And so I was curious as to whether you knew exactly what the governor had in mind on October 31st.
Yeah, I'm looking it up right now. I mean, we've already rescinded. I mean, even the federal government, you can wear every requirement I can think of. You can wear them in public transit now. You can wear them on or you don't need to wear a mask on airplanes now. You don't need to wear them on, I know that the federal government mandates a negative test. So we recommend, like, if you get a test, sorry, I'm looking this up. What possibly else they could be changing on October 31st. So it says Governor Inslee announced the upcoming rescission of all remaining COVID-19 emergency proclamations in the state. So the only other ones I can think of would be, and I'm looking at the website to see, I mean, healthcare providers are mandated. I know that childcare and school are still going to be mandated because that was part of the 2022-2023. So, so on October 27th, October 31st, the remaining 10 orders to be lifted include the underlying state of emergency. And I can put this website in here.
Okay, and we can look into that a little bit further. It sounds like we still need some information that we need to gather. The long and the short of it is, ideally, perhaps we would meet either virtually, maybe we would meet outside, maybe we would spread out 10 feet of everybody around us, maybe we would have masks on, whether we would be vaccinated, boosted, fully boosted, whatever that means, however many shots you can take, you have them. There's a lot of things that we can do. I think as a board, we're going to have to examine what measures we want to take, what measures that we think is viable and will still allow us to gather, meet, and do the important work of the Bar Association. So I think that's our challenge. Thank you so much for attending and giving this very valuable information to us. Thank you.
You're very welcome. I'm putting in the chat I just found the site that has the 10 remaining that they are going to be lifting. So I put it in the chat. So hopefully that is helpful for folks. But again, you all get to decide what you want to do to stay safe. And I will say, we're not always we follow the CDC and we work with DOH to create policies, and we're not always in agreement, right? But we've actually changed some, like with monkeypox, for example, we added we added a group that the CDC did not have on their who can get vaccinated list, right? So we're not always in agreement, but yeah, or in the know, let's say. The mask mandate got lifted by CDC, and I found out about it the same way everyone else, which meant we were scrambling. But what, the information I shared with you today is hopefully helpful. There are definitely ways to mitigate getting COVID. We had no flu season the first year when we had the mask mandate. That tells you they work, right? And yeah, the CDC and public health would absolutely say to mandate the vaccines. And if they wouldn't say the mandate, which they did because we did, they would say they're the best way. So I hope this is helpful. I'm happy to answer any additional questions. I can put
I just have one quick question. So if I like to talk to my doctor about medical advice. So should I follow my doctor's advice or should I follow your department's advice if the two happen to be different?
I don't know what your medical conditions are. So this is where when people have specific medical conditions, I talked to somebody who was in cancer treatment and she was getting a vaccine a week. Never heard of it, right? But because of the medical treatment she was receiving specifically was killing her immune system, they were doing this very unique situation with her. So I don't know what medical conditions you may have. And so that's where talking to your doctor is absolutely critical. If you have specific medical conditions, what I will say is both Moderna and Pfizer, I've seen the research and I can actually share it with you, who was in the studies, did a great job of, especially Moderna, did a great job of making sure to have a very diverse group of folks in the studies in terms of race and ethnicity, a diverse group of folks in the studies in terms of underlying health conditions like diabetes. And so, there aren't many reasons why people could not get a vaccine or a booster. I've definitely talked to people whose doctors have said, oh, you're healthy, you're fine, you don't need that second booster, you're over 50, but you don't need it. And, again, we would say to get the second booster for folks who are over 50. So it's I've definitely heard of doctors going in a different direction than our recommendations, but our recommendations are based on numbers of death, hospitalization, and who, like folks who are 18 and over can also are recommended to get a second booster if they're immunocompromised, right? And that's based on who we saw dying and hospitalized, who would get COVID. So right now, the folks who are dying are 65 and older. But I will also tell you that the biggest rate of folks who've gotten boosted are, we're not seeing more deaths because the biggest rate of folks who are boosted are over 50. So otherwise we'd be seeing more deaths.
So anybody else have any questions for our presenter? Missing any hands? Just speak up if you have a question. I don't think anybody else has any questions. Thank you so very, very much for being here today and being here long past when we thought you would have to be here. So thanks so much for answering all the questions and all the information.
It always takes longer. And again, I'm going to I did put my email in the chat. Did I put it in the chat? Yes, to everyone. And then I'm going to again put our website in the chat. Our website has tons, it's not coming up. it won't let me copy and paste. So it's in the chat. It won't let me copy and paste from the chat, but our website has phenomenal information on it, and we scrub it constantly so we can add updated information as it comes up to date. I actually was on the CDC website the other day, and I will say ours, we're quicker at scrubbing ours. So I do recommend, oh, there's a hand up from a phone number. I don't see a name, but it's a 206 phone number.
Governor Stevens, you still have another question?
Well, I have just a request of, can you hear me?
Yeah, I can hear
Yes.
No, I have a request, and maybe we're already handling that, which is your presentation. Can we get it so that it can then be shared with everybody on the Board of Governors? I appreciate the presentation. I think this is going to come up a few times in various circles, and I think that would be helpful.
Yeah, you're very welcome to my presentation, and I want to make sure I usually put links in. So I want to make sure I'll go back in, and there's some links that are missing, like from the CDC. So I will go in and put you'll get a PDF, but the links will be live.
Okay, thanks again, Ms. Wrightsies.
Thank you very much for having me. I know my answers are not always satisfactory to people, especially without having a crystal ball for the future. I'm going to do one last plug for global public health. It's a way to end this. Is getting impoverished countries the vaccine. We will stop seeing the variants if we can get everybody who wants the vaccine vaccinated. So that's my plug for global public health. It's critical.
Okay, thanks so much.
All
All right,
thank you.
folks, it's about 6 minutes to noon, and we're scheduled to have lunch at noon. We didn't get to our discussion of the policy, and I do not want to move the budget and audit committee items that are scheduled for 1 p.m. So we're going to break for lunch, come back and do the budget and audit committee items, and then budget and audit committee items, and then we're going to figure out where we can fit the vaccination policy discussion in later in the meeting. We still got a lot of time. So we're going to recess for lunch. See you all after lunch at 1 o'clock today.